similar question. Will you please give me a second so that I can drink a little water?
How to talk about various practice. This session focused on named or range of different specialists or practitioners based on their work. It includes professionals who
Okay, we had little bit more to finish the right and wrong, but since become it will become more for today, more conceptual once we will have little bit understanding of it, and we will discuss this in tomorrow's class because we need also grasp and understood these concept in a detail. Now we are leaving the type of doctors in the previous classes. We will not discuss them today, but we will
yes.
discuss different type of the practitioners. Some of the route may come today, so don't be worried about that. So we come across different type of occupationist, those people who practice different type of professions. But are we able to pronounce them correctly, say them correctly with the correct professions they are doing? Like we come across study those people who study human behavior, use Freud's psychoanalytic methods, straightens teeth, measures eyesight vision, treat minor food problems, analyze handwriting, deals with aging and elderly care, using manipulation and massages for the treatment. So what do we call them? Starting with the very first one, many professions begin. Okay, so this was an idea. This practitioner studies human behavior, emotions, and personality. They understand why people act and feel way they do. They may work in industries, institutions, and therapy
Psychologist.
settings. Yeah, yes, absolutely. We call them psychologists. So
Psychologist.
here is an explanation to make a clear
Okay.
distinction. They studies human behavior, emotion, personality, improve productivity, happiness, and mental well-being. Okay.
So, Dada, can you
Yes. What can
can you
I?
repeat Dada, can you repeat the pronunciation of these words? Psycho,
Psychologist.
psy,
Psychologist. Okay. Don't worry.
psycho.
Bother about the pronunciation right now. We will have the separate slide for pronunciation of each words. Okay. You can
Okay.
only may mark just a wider understanding definition of these particular portions, and I will send the PPTs, furnish the PPTs to you. Now, these people take care of your worries, fear, and conflict. Make a difference between the two people. They work for your productivity, happiness, and mental well-being. But these people work for your worries, fears of failing an exam or passing, conflict, whether should I study or not. This practitioner is a physician, psychiatrist, or psychologist trained in a Freud's technique. So there was a psychologist who developed some kind of hypnosis, and some methods to look one's unconscious brain. They explore the unconscious mind. They help patients understand past experiences only, traumas, fears, and conflict. Treatment involves regular sessions, listening, and interpreting thoughts. So these people are called psychoanalyst,
Okay. अच्छा psycho anal
psychoanalyst.
analyst.
Yes, psychoanalyst. So how
Psychoanalyst.
psychoanalysts are different from psychologists? So psychologists work to improve your productivity, happiness, and mental well-being. But psychoanalyst works for your worries, fears, and conflict. Okay, basically they look your past experiences, traumas, etc., and they help you to come over them. Got the difference between two?
Yes, Dada.
Okay, I think you still today having similar type of headache. Okay, but no worries. Only two people are, and we have discussed them, psychologist and psychoanalyst. Now we are having very, very
Cycle.
good doc practitioners today. Now these people take care of your teeth. These practitioner is a dentist with special ability, special training. We can say straightening teeth. Okay, they
Mm.
correct tooth alignment and bite problems. And these professionals are called orthodontist. We have discussed them. Orthodontist.
Yes.
They basically correct your tooth alignments.
Yes.
So you visit the doctor who corrects your tooth alignment is an orthodontist. Got it? Now we
Yes, sir.
discussed of the eye doctor in the yesterday classes, and eye doctor are called ophthalmologist or ophthalmologist. These practitioners
Ophthalmic.
test your eyesight, your vision. So they are basically optometrist. Opto
Optometrist.
basically related to the optics, how things are visible to us, physics. Metrist or related to measurement. Optometrist. Are you okay?
Yes, sir.
Optometrist or ophthalmic optician. Forget ophthalmic optician. Now, these people take care of your glasses. These practitioners make or supplies lenses glasses based on the measurement received from the
Lines.
optometrist. And we do call them optician. But since they are dispensing your lenses, we call them dispensing opticians. Okay.
Mm.
Now, those people who take care of your bones and as well as blood vessels. These practitioners belong to a profession started in 1874 by Andrew T. Still. They treat drungless methods such as massage and body manipulation. Though we call them separate word chiropractitioner, I think, based on the idea that displaced bone, many pressures, nerves, and blood vessels causing illnesses. So if my bone is out of its shape, so it will distort the veins path, arteries and veins path in my body, and due to that I will have kind of a pain in my body. The nerve system, the blood vessel system will in our body will distorted, and I may feel a kind of a paralysis. So these people are called osteopath. Osteopath. Can you pronounce the word?
Osteopath.
Yes,
Osteopath.
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 They basically use massage and body manipulation, massage therapy, etc. Okay, they take care of the bones and blood vessels. Bone displaced from its original position distort the blood vessels. Now, those people who take care of your joint and articulations, these practitioners focus on the structure and functional health of the nerve system. Treatment mainly involves manipulating body joints, especially the spines, and these practitioners are called chiropractitioner. So they are called chiropractitioner. I told you just a moment back. So they take care of your nerve system, that is a spinal cord. Okay, they only fix your spinal cord, especially in fixing the spinal cord. And spinal cord is greatly related to the nerve system or our brain. Like they are the wire socket, you can say, of brain. They are chiropractitioner, and those people who take care of the other bones in your body, those distorting the path of the blood vessels, they are osteopath. Got the difference? Okay. Now those people who take care of your feet, these practitioners treat minor food problem and like cons, uh, many kind of the food problems we have, and these are called chiropodist. either chiropodist or podiatrist. Pod basically means you have learned this word in the tripod. Pod, three pod, basically tripod. So they are fixing it. That's why they are called chiropodist or podiatrist. Okay, foot. They are basically straightening your foot's bone. That's it. Now these people analyze your writings, and let me tell you, it is a great science we can say. Through your writing, your signatures, I can tell you essentially about your personality overall. Like in case of mine, I write in Hindi and I make Lord Shiva's.
Lord Krishna.
No, in my signature, I made Lord. I write Krishna, but I
Yes.
make actually a little persona of Lord Shiva. So one can easily figure it out that I am having a deep interest in spirituality. So like that way, and these practitioner basically can tell a great deal out of that only the signature. Your signature tells lot of things. So those people who are analyzing them, practicing the analysis of one's handwriting, judge character, personalities, and abilities. They may also examine your signatures and documents for authenticity. These professionals are called graphologists. A very simple one. And why they are doing so? Because to check the authenticity of your documents, basically. And it was used in the older time because nowadays the computer and the AI are doing this. In the past time, we have the specialist to analyze the signatures, whether it is the true signature or not. We have the people, trained people, we call them graphologist. Graph is basically related to the writing. Okay. Next time you come across the word graph, that is related to the writing. Okay. Now we are getting bored. Only few of the characters, practitioner we have to discuss. Then we will have a little short quiz on that. Those people who take care of the elderly peoples specialize in issue related to the agings and elderly life. They deal with economic, social, sexual, retirement, and personal problem of the older adults. And these people are called uh, what gerno gerontologist.
Gerontologist.
I think the pronunciation should be gerontologist. Okay, let me check it. Huh? Chiropractitioner, gerontologist. Okay, I will check the pronunciation again. You can till then say them gerontologist or gerontologist, whatever you want to say. I will check the pronunciation and then I come to you. Okay. Now, can you pronounce the word? So let's see first your pronunciation and then I'll correct it up.
Psycho, psych,
Okay. Pronounce a little bit
psychologist.
louder.
Psychologist.
Yes, wonderful.
Psychoanalyst.
Psychoanalyst.
चलो एक मिनट और साइको
Analyst.
एनालिस्ट साइको साइको एनालिस्ट
Yes.
ऑर्थोडोंटिस्ट
Yes, wonderful. Orthodontist.
ऑप्टोमेट्रिस्ट
Optometrist. Wonderful.
ऑप्टिशियन
Ex excellent.
ऑस्टियो ऑस्टियोपैथ
Excellent.
जीरो
Chiro.
चायरोप्रैक्टर
Yes, it is chiropractor.
कायरो कायरो एक मिनट Chiropodist.
Yes, chiropodist. Wonderful. So the first pronunciation is psychologist. Okay, we can call it psychologist, but actual pronunciation is psychologist. But you can call it
Psychologist.
psychologist because in India and many part of
Psychologist.
the world it is being called psychologist.
Psychologist.
Psychoanalyst. Now, how to pronounce these words like psy, call, psy? We put little stress on those words which are being written in the capital letter caps. Okay, psychologist,
Psychologist.
psychologist.
Psychol. Psychologist.
Then we have the next one that is psychoanalyst, psychoanalyst.
Psychoanalyst.
Yes.
Psychoanalyst.
Then we have in actual
Author.
British people don't actually take care of the R, but we can ortho. We say it ortho, but in actual pronunciation is orthodontist, orthodontist, orthodontist. You can also say. Then we have optom. We will make a little stress on tom.
Op.
Optometrist, optometrist.
Optom.
Then we have the next one, optician.
Optician.
Op,
Optician.
not the but T. Optician. Little stress
Optician.
on T-shirt. Optician.
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 Optician. Optician.
Yes. Then we have osteopath. Osteopath.
Osteopath. Osteopath.
Yes. You'll pronounce like this. People will say, oh my
Chiro.
goodness. Kai, though it is
Ro.
key. Chiropractor. Chiropractor.
Chiropractor. Chiropractor.
Then we have the next one is chiro
Chiropractor.
chiropodist. Chiropodist.
Chiroptist.
Yes.
Chiroptist.
Hmm. We actually in India we say chiropodist, but it is not podist. Okay, in English, the O is sounds like a. So that's why we are having
Okay.
chiropodist. Chiropodist.
Chi-
Okay, now I
Chiropodist.
want you to pronounce all these words.
Okay. Psychologist.
Yes,
एक यही आया मेरे को तो साइक साइको साइको एनालिस्ट
yes,
ऑर्थाड ऑर्थोडोंटिस्ट
yes, orthodontist.
ऑर्थोडोंटिस्ट ऑप ऑप्टेमे ऑप्टामेस्ट्रिक रुकिए
Yes,
ऑप्टोमेस
optometrist,
ऑप्टोमेस्ट्रिक्स ऑप्टिशियन
optician. We don't
ऑप्टिशियन
take little more stress on CN. We say SN. Optician.
ऑप्टेशन
Optician.
ऑप्टेशन ऑप्टेशन
Optician, you can also say optician.
ऑप्टिशियन ऑस्टे ऑस्टियोपैथ
Osteopath.
ऑस्टियोपैथ कायरोप्रैक स्पेलिंग क्या
Sir.
थी
Chiro-
कायरोप्रैक्टर
Yes.
कायरो कायरोटिस्ट
Okay,
कायरोटिस्ट
wonderful. Now I want you work with the meaning of these words. So, who is a psychologist? Has to
इट
work
शुड
with
बी
the vision, the unconscious, behavior, feet, teeth. What option you should choose?
ऑप्शन सी बिहेवियर
Yes, wonderful. Psychoanalyst. What do you think will not?
आई थिंक इट शुड बी it should be problem of aging I or B.
Psychoanalysts are people who study your unconscious, right? They are working basically with your conflict, and conflict
Okay.
always come from your unconscious. Like there is a story that you can tell a smoker not to smoke, and he will understand it. But which part of brain he understanding by is the conscious brain, and which part of the brain he is forcing him to do smoke is his unconscious. That's why he's having dualism. Okay, so psychoanalyst people are those who work with the unconscious. Now, I orthodontist are those people who
It should
work
be
with orthodontist.
straight in teeth.
Yes, wonderful. Optometrist are those people who work what?
Optometrist, I think eye vision.
Yes, wonderful. Osteopath are those people who work with.
Osteopath, it should be osteopath. It should be, it should be bones and the yeah, F, bones and the blood vessels.
Yes, bones and blood vessels. Chiropractor are those people who works.
Joint, joints of spine,
Yes, chiropodist are those people who works with. Remember the pod.
podist. I think, feet.
Yes, graphologist are the people who deals with.
Handwriting,
Yes,
handwriting.
yes. Gerontologist are those people who deals in.
Problems of that.
Yes, they take care of the elderly people problems of the aging. So now only we will have the quiz. So let me revise you. A psychologist must also be a doctor. What do you
No,
think? Yes or no?
no, no.
I think yes. Psychologist.
Why the
Doctor are
cycle?
is a wider term. Doctor is a wider term, right? A psychologist also a doctor. Must be also a
Also a
doctor.
doctor.
It means yes, he's a doctor. A psychoanalyst
The
follow Freudian techniques. Basically, is he works in one's unconscious or not?
unconscious, yes.
An orthodontist is specialized in straightening teeth. Yes or no?
Yes,
An optometrist prescribe and fit glasses.
yes,
Optometrist. An osteopath may uses massage and other manipulative techniques to fill your, correct your bones, blood vessels.
yes,
A chiropractor treats cord and bunions. So basically, they are the joint related, bone
yes,
related.
yes,
The graphologist analyze characters from handwriting.
yes,
A gerontologist is interested in the problems of
yes. Adult,
adolescence,
adolescence, yes.
adult. Like I am an adult. I am aged person or adult.
You are adult.
So gerontologists are
Older
take care
people.
of the aged person, right? Old age. It should be no. Yes, got it.
Okay, okay, okay.
Okay, so let's have. Now, can you recall the words? Okay. So they develops into your unconsciousness. They go your unconsciousness. What was the word? What were they?
Psychoanalyst, analyst.
Wonderful. Use either massage or manipulative or other standard medical procedures to treat illnesses related
That
to
was
bone.
वो कुछ तो पैथ था वो.
Yes, osteopath. Take care of the minor
Osteo.
ailments of the feet.
That was all feet. um, I don't know that I'm not able.
Orthopodist.
Orthopodist.
Those people who take care of straightening your teeth.
Orthodontist.
Wonderful. Analyze your handwriting.
Graphologist.
Logist.
Graphologist.
Yeah, these people dispense glasses and contact lenses.
Optometrist.
Yeah, dispensive optometrist deals with the problems of aging. We talked of movement.
It should be uh, gyno or
Gerontologist.
Sorry, gerontologist.
Manipulates articulates connected to your spinal column.
It should be spinal cord. I don't know that. I'm not
You
able.
don't know? Chiropractor.
Okay,
Studies and explain human behavior.
that is psychologist.
Measures vision and prescribe glasses.
That is uh, optometrics.
Okay, wonderful. And now I think you understood today better than tomorrow. What do you think?
Yes, I also think.
Okay, so this was the last session of the type of doctors and practitioners. Until now, we have discussed many. And believe me, if you next time go to hospital and you say the doctor actually by its profession, he himself will be impressed. Like a lot of people are saying teeth doctor, etc. doctor. Okay, it will sound like you are more educated person. Also, when you are going to say in a public, like you say, I am having session with orthodontist, they will say, oh, what is orthodontist? Okay, you will be sound more educated in the public speech. Okay,
Okay,
so let's end this class and I'll furnish the PPT, and I assume that you go once more with all these PPT and type of doctors, and from tomorrow onward we will have a very separate session. Okay.
okay. Dada, can you tell me the topic of tomorrow?
Okay, I will tell you in the text because I also have to inquire which topic we are going to cover. Okay. So till
Okay,
then,
Dada. Okay.
happy learning and learn with positivity. Learn like you are going to learn something new out of it. Don't go to learn like don't make it boring. Learn it
Okay.
in a way that it will add some value in
Good.
your personality. Okay. So have a
Okay. Thank
great
you.
night and good night. We will meet on the very next
Thank
one.
you. You too, Dada. Thank you so much.
Okay.